these are pretty important. I think they do cover a range of all the things that we see, from students succeeding in activism to faculty success to our staff and our advising group putting their efforts forward in our work with the town. So it's a pleasure now to begin the second phase of the meeting when we have two wonderful presentations. The first presentation is, I'm going to start off, I think, by asking Dr. Guskiewicz to lead this presentation, but he's brought a wonderful team with him. Some of you may know that he was featured on 60 Minutes on Sunday. I don't know how many of you saw that, but that was pretty exciting in talking about concussions, because he is an expert on concussions. One of the reasons I think this is particularly appropriate right now is because they do, of course, do lots of work on athletes, and through the Matthew Gfeller Sports-Related Traumatic Brain Injury Research Center, but they also do a great deal of work with military service members. So again, they're going to talk about research in both of those areas today. He's going to be joined by Jason Mihalik, who's the co-director of the Matthew Gfeller Center, and also spoke at our recent Tar Heel pregame lecture, which was wonderful, and also Jana Register Mihalik, who's an associate professor in exercise and sport science. We also have Robert Linall, PhD student, who is here, who works in the curriculum on human movement science, and Destiny Grove, an undergraduate student who is in the Department of Exercise and Sports Science and Psychology and Neuroscience, once again demonstrating the absolute breadth of the research teams that take place here. So with no further introduction, thank you, Kevin.
Thank you, Chancellor Folt, Chairman Stone. It was a pleasure to receive the invitation to present to the board on this important topic. And just a little bit of background. When I arrived in 1995, I started in a laboratory that was no bigger than the table, the area of the table that you're sitting at. In those 20 years, we've come a long way. During the first 2 years of the program where we began this concussion research, it was myself and two master's students that I was more or less assigned. Today, the Matthew Gfeller Sport-Related Traumatic Brain Injury Center, we have 4 faculty members that work in a collective way, a collaborative way through the center, 8 doctoral students, 2 postdoctoral students, 4 to 5 master's students, and about 9 undergraduate students. And we could not do this work with just Jason Mihalik and myself, who co-direct the center. This is truly a team effort, and one that I'm very proud of, and looking forward to introducing my colleagues here. We have about a 25-minute presentation that Dwayne has asked us to talk through. I'm going to sort of set the stage, and then everyone's going to have an opportunity to talk, but we brought some great representatives today. So just want to sort of set the stage and say that it's rare to pick up a newspaper in a given week, turn on the nightly news in a given week, and to not hear something about sport concussion. This is from the Atlantic magazine from 2012, and 2012 was sort of a turning point on this topic. This was the point at which I think people really began to take this topic seriously. Right before the holiday break, a friend of mine sent me this link to this Atlantic magazine article, The 10 Ideas That Changed the World in 2012. And when I opened it up, the first item here was about our U.S. military's drone system. And I was like, why in the world is Doug sending me this article? And I sort of read through it. But as I quickly flipped through to the 4th item here, with this being the 4th of those 10 ideas that changed the world in 2012, football players beware, concussions can be deadly. And our center had been working on this topic long before 2012. In fact, it was in 2011 that we helped to change the rules in the sport of football, which has helped to reduce concussions on the kickoff by about 45% on that one play, as just one example of where science and technology can be a game changer. And so we're proud of the fact that we've been a leader in this area. This slide just illustrates how far we have come on this topic. This is looking at this is a PubMed search, searching the word sport concussion or mild traumatic brain injury in sport. And as you can see, there was very little published on this topic, very little research funding toward concussion, sport-related concussion, prior to about 1995. And I'm proud to say that, as you can see the bar graph there, just from 2010 to the present, in the past 5 years, we've more than doubled the number of publications on this topic. And I can guarantee you that UNC-Chapel Hill shows up in many of those articles that are published through a peer review process. And we're very proud of that fact. Many of my colleagues around the country say, how in the world do you do this work at Carolina? We're envious. And I'll tell you that it really, when I talk about being an amazing place with amazing people that care about this, when I arrived in '95, I was told by our medical staff, by our coaching staff, not just in football but across the board, by our student athletes, that this was something we wanted to lead in, and we have led in that area over the past 20 years because we have had the buy-in from the chancellor, the provost, the athletic directors that have supported this work, and the many coaches to allow us to study our student athletes and our coaches and to really become a leader in this. One of the challenges with this injury is that concussion is sort of been described as a hidden injury. It's one that we cannot see very clearly on neuroimaging. It's probably the only sport-related injury that cannot be seen through some form of imaging. We have the very best neuroimaging in the world over at Marsico Hall. Many of you know, and many of you were at that dedication about 18 months ago. It's a world-class facility, and we will get there, but one of the challenges that we have is that this is an injury, and this is probably the most sophisticated way to look at this through something called diffusion tensor imaging, where we can actually look at the white matter connectivity of the brain. And we have ongoing studies both in our student athletes as well as in the military service members that Jason's going to describe that are allowing us to fine-tune this technology to where I think we will someday have a biomarker, be it a blood biomarker or a neuroimaging technique that will help us to better identify this injury and take out some of the guesswork that exists around managing this injury. So before I turn it over to Jason, I like to illustrate sort of where we've come on this one slide. And when I say concussion solution, I don't by any means want to suggest that we have in fact solved the problem, but there are a few places I think that have approached it in the way that we have. And I want to say that on the right-hand side of this rather busy slide, I'll apologize up front, has to do with the validation of assessment tools. And our group has led in this area where we have helped to identify and validate the best tools available to assess this injury at the sideline and in the clinical setting. We moved on from that work, moving left on this slide, to really begin looking at the neuroimaging biomarkers, where we have a large study that's funded by the Department of Defense and the NCAA. There's a partnership you wouldn't think of. The NCAA and the Department of Defense funding a very large multi-center study, of which Carolina is one of the 4 universities that are taking part in this, but we're taking blood work, neuroimaging, and so we're going to be, again, answering some of these questions. We're also looking at acute treatment biomarker, or acute treatment and therapeutics around this injury, omega-3 fatty acid, hyperbaric oxygen treatment. Jason has led a study in that area. But more recently, we have focused on the left-hand side of this equation. In yellow, Jana, Registrar Mihalik, is going to talk a bit about some of the work we're doing just around identifying behaviors and attitudes around concussion and what education might mean in terms of better identifying these issues. And then the biomechanics work, where we were featured on 60 Minutes the other night, talking about the use of accelerometers in helmets, and Rob Lionel's going to talk about that. Destiny Grove's going to talk about her unique experiences as an undergraduate working through our center. So this is a quick snapshot. In the middle in green there talks about some of the outcomes of this work, because I always say research just for the sake of research is useless. It's what you do with it. It's how you apply it. And we are changing rules. We're working on behavior modification and showing athletes and coaches how we can, in fact, prevent injuries so that they never make it to the other side of this concussion equation where we actually have to diagnose and treat them. This is our situation room at the Matthew Gfeller Traumatic Brain Injury Research Center. This is myself and Rob and one of our former doctoral students breaking down game film, looking at the way that these impacts show up not only on film but through the accelerometers and the helmets, and how we might think about game changes to the game that might, in fact, improve safety in sport. And so with that, I'm going to turn it over to Jason Mihalik, my co-director of the center, where he's going to really talk about some of the work we've done and this important work in bridging our work with athletes and our military service members. So I'll come back at the end and tie it together. Thank you.
Thank you, Kevin. Thank you, Chancellor and the board, for another opportunity to present on some of our work. As Kevin mentioned, over the last 20 years, the center and the work that he's laid the ground floor for has been focused on the athletic side of this problem. And in athletics, we worry about impact injuries. So what's happening when a head collides with another head, or a head with a body, or a head with the ground, and so forth. And a lot of the work that we do here with our student athletes is pivotal, and a lot of institutions across the country have looked to UNC as a model for how to incorporate some of this clinical work in their own paradigms. And in fact, the NCAA has used our concussion management policy as the template from which other institutions should write theirs. Part of what we do with all of our incoming student athletes, just to give you a little bit of background of our program, is every freshman athlete or first-year student coming through comes through our center and completes a battery of testing, both cognitive testing, balance testing. We take a number of symptom inventories and other type of neurobehavioral inventories. And if they don't get injured, we have the great pleasure of never seeing them again. But if they do, we have a very good relationship with our clinical staff, and our center is the location where they get referred back to for post-injury testing. And so part of that is obviously the clinical care and the well-being of our student athletes, but from our standpoint, we also have access to the data, and we could understand and answer some of these important, challenging questions. And we've been doing this for some time now. And lately, the last 2 years or so, the NCAA and DoD, in this very unlikely relationship, or marriage, if you will, have funded a large multi-site study. We are one of 25 sites at the current time looking at those clinical measures. But then of those 25 sites, 3 have been identified as advanced leaders in this field. And part of that is looking at advanced metrics like neuroimaging, biomechanics, blood biomarkers, and so forth, that the other 22 sites are either incapable or just aren't being asked to do. In that transition, about 4 years ago, we were approached by a unit within the U.S. Army Special Operations Command for our expertise. For some time, they had been referring their operators out to centers in Atlanta, centers in D.C., to the Mayo Clinic, and it came to the realization that we're 90 minutes up the road and that we might be a good venue for them. And so they came to see us, and their mission at the time was to develop clinical normative data so that we can have a good map, or a good atlas, if you will, of how to compare those operators within that unit post-injury to their own norms. For reasons that we don't yet understand, they are different from the traditional soldier, and if they weren't, then they wouldn't be a part of this unit. So there's something inherently unique about them. And the challenge was that they were being administered tests where, by virtue of their training and their resiliency, they were maxing out, even post-injury. So being able to manage and identify those deficits was a big challenge for them. And for our athletes, being injured and being out of sport or out of the classroom for a couple of days may not be life and death, but for some of the activities that these operators engage in, it very much is life and death. And so the ability to see 2012 when you actually have 2012 is very important. And when someone now has 2016 vision after an injury and you send them to an ophthalmologist, the ophthalmologist says, I have a room full of blind people. You're 2016. I can't really help you. But for them, it's a really big life and death decision-making process. So their instructions to us was to go very slow and systematic and try to steadily answer some of these important clinical questions. It turns out that I just heard from a Nobel laureate, I probably just need to go consult with Aesop's fables, and I'll probably find a lot of the answers here. But it's definitely a challenging problem, and it's one that we're very excited to be working with them on. Part of the program is an extension of the work that we've been doing. So we are doing advanced neuroimaging, both structural and functional imaging. We are looking at blood, so plasma and serum biomarkers, in the hopes that we can identify something that we could use as perhaps a litmus test in theater, something that could prompt them with a very quick decision to say, injured, out, do we evac or do we continue the mission? These are very important components to their operational readiness. We also do a lot of vision and sensory performance testing. The unit had been using this type of testing for their performance and shooting accuracy training, but we see very good synergies with brain injury diagnostics and brain injury rehab in this group as well. And then we also described all of our standard TBI measures, our balance, our neurocognitive testing, and these are all things that they do. Kevin mentioned a technique called diffusion tensor imaging, and so what we're able to do is kind of take away all the gray matter and look at the information superhighway of the brain. It's kind of like the Waze app of brain imaging, if you will. So it's not that people can't remember things, or it's not that people cannot react to things. They just don't react and remember them in the same way. And so while we can drive from here to Greensboro going 65 miles an hour down 40, a concussion causes a construction jam, and we need to find a way around it. We can still get to Greensboro. It's going to take a little bit longer. We might get frustrated along the way. But the idea is that the brain can reconnect. The brain is fairly plastic, and what we're trying to achieve here, or try to understand, is how these unit operators replastify their brain, if you will, and how they make those connections again, and can they ever return to those really strong, efficient pathways that they need for operational readiness and clinical decision making. Another area that we focus on is in head impact biomechanics, and we also, I mentioned the blood biomarkers, and I won't bore you with those trivial details this morning, but we also look at head impact biomechanics and blast in the context of these military operators. And I think this is a perfect opportunity to invite Rob to replace me here at the podium and talk to you a little bit about his experiences with these devices and his own personal experience with the military. So with that said, I'll invite Rob, and I'll be back towards the end also to help Kevin tie it all together. So thank you for your time.
Thank you, Jason, and thank you to everyone for letting me be here this morning. So Jason mentioned we're doing a lot of different things, and one of the things we're working on here is head impact biomechanics, or measuring on-field, and when we're talking about athletes, on-field head impacts, getting an idea of how hard they're getting hit, how often they're getting hit, and where on the helmet they're getting hit. So we have a few different systems, and Jason and Kevin are really pioneers in this field. Back in 2004, they're one of the first ones to apply these kind of devices to actual on-field situations, so we could move out of the laboratory and onto the field and try to understand what's happening, specifically in football, at least at the time. So this is one of the systems, and it's the one we've been using since 2004, called the HIT system, the Head Impact Telemetry System. You can see it right here. It's these red circles. Underneath them are accelerometers, single-axis accelerometers, and they're what allow us to measure the magnitude and frequency and location of the impacts. We take this horseshoe-collared device, and we put it inside a football helmet. So I hope you can see the red circles in there. But basically, there's a dead space in the helmet where there's no padding. And so this device slides right in there. It allows our players to be on the field wearing their helmet as they normally do, but allows us to record information about the impacts they sustain. So it's a passive device that they don't feel is doing anything, but it's recording information about their impacts. So we've come a long way with this system, but one of the biggest limitations to it is the fact that it has to go in this helmet. And it's even a little more limited than that, in that it only fits inside 3 types of helmet, and there's many more than 3 types of helmet out there. So we've been very limited in information we can record. More recently, other devices have been developed that allow us to move beyond football. Thank you, Jason. So this is an example right here. This is called the X patch. And I'm happy to pass these around. You'll see how small this is, but it actually adheres behind the ear. So we just take tape and we affix it on the bony protuberance behind the ear here. And it allows non-helmeted sports, allows us to measure these things in non-helmeted sports. So we've actually recently, in the last couple of years, expanded to soccer and lacrosse to start to understand and to move beyond football and really get a good idea across the board of all sports where there may be head impacts. These devices allow us to start to understand what's happening there. Some other devices as well. This one's called a G-force tracker, about the size of a domino. You can affix this in a headband or to a helmet. And we have some others as well. So we've done a lot of work lately to try to understand what these devices can and cannot do and how effective they are on the field. So that's just one of the things we're doing in the Gfeller Center. And as Jason mentioned, I'm in my 4th year in the PhD program, the Human Movement Science curriculum. And I've been in the Gfeller Center now for 4 years. And so I have a bit of a unique background, I think, in that the Gfeller Center, the Gfeller Center attracted me for a lot of reasons, but one of which was my time in the military. In 2002, I enlisted in the Marine Corps and served for 5 years. You see lots of pictures of airplanes. I had the opportunity to fly in that KC-130J right there. And I had a wonderful time. It was an amazing 5 years. I decided to get out and go back to school, and so I did. I went to Illinois State University, and I got my bachelor's and master's degrees in athletic training, so very clinically based backgrounds, not different than the 3 faculty members here, actually. And so the Gfeller Center was a unique opportunity. In fact, it was really the only place that I knew of in the world that allowed me to study concussion and head impacts in a military setting and in a clinical sports setting. And so I've had some incredible experiences over the past 4 years with both the military folks and of course, our athletes here, high school athletes, and many others that we've had the opportunity to work with. And just to finish up here, Jason mentioned that we're recording these head impacts, and I showed you these devices for on the field. Sometimes our military personnel sustain very different head trauma, and that's head trauma from blast. And frankly, we don't understand a whole lot about head impacts on the field in sports, and we understand even less about brain damage from blast exposure. So one of the things we've done with the military folks that we've worked with is introduce these devices here, and this is a blast gauge. There's a few different kinds. This is one of them. Essentially, it's similar to the devices I showed you, but it measures over and under pressures from blast waves. So it allows us to, we affix these devices to helmets, to gear on the chest, several different places, and we were able to learn things about blast exposure in our military personnel. What we can then do is take the exposure from the blast and recreate the explosion using computer simulations. And obviously, it's very hard to study blast in a laboratory, and especially in humans. You can't do it. So we're able to take all the information from the service members, the imaging that we do, the blood biomarkers, and then tie it in with the blast gauges to really get an idea of what they were exposed to, how long, what direction it came from, to try to get a more full understanding of the injury. So just a snapshot of some of the things we're doing in the Gfeller Center from a head impact and a blast exposure standpoint. So I believe Destiny's going to get up now and talk a little bit about some of the work she's done. Thank you.
Good morning. Thank you all for having me. As Chancellor Folt said, I am not only in the Department of Exercise and Sports Science, but I'm also in the Department of Psychology and Neurosciences. And you all are probably kind of wondering how psychology and neuroscience fit into traumatic brain injury and concussion research. But if you look to the screen here, cognitive and motor functioning are not the only components that are damaged in these injuries, but a person's mental aspect and the psychosocial component of a person are also affected. So by studying the psychosocial and psychology components of these injuries, we can answer questions about people like how do their personalities change when they become concussed or have a traumatic brain injury, and why, for how long? Is it due to neuronal changes within the brain, or is it due to the personal challenges of having to deal with the aftermath of their injuries? Something about me is I'm also from a small town, so I also like to deal with healthcare disparities and how limited access to healthcare affects recovery from concussion and traumatic brain injury. So how do rural athletes who have limited access to healthcare, how does their recovery differ from that of their urban counterparts? How does limited access to healthcare play into the development of long-term sequelae, such as depression, CTE, mild cognitive impairment, and traumatic brain injury? So those are the kind of things that I'm interested in, and those are the kind of things that brought me to the Gfeller Center. This summer, I had the pleasure of working as a summer research assistant, and I did a lot of things, and I got to learn a lot of things about the importance of qualitative research and its methods and analysis. I got to test out and administer a lot of really innovative measurements, like our NeuroCom system, which is a balance assessment, and the Synaptic Sensory Station, which does a lot of sensory things like vestibular, ocular, motor, sensory reaction times, things in that nature. I also got to write my very own research protocol and accompanying IRB. And that was just really cool. A lot of people, especially at my age, so young, don't get that experience, and that was awesome. I'm currently still there. I'm sorry, I forgot I have these slides. I'm currently still there, but now I'm working on how recreational athletes perceive the concussion assessment battery. So I bring them in, and we run through a lot of these things, the postural control balance tests, stress tests here, so vestibular, ocular motor functioning, things like that. We run them through the whole assessment battery, and then we give them a survey, so more qualitative research about how they feel about it. And a lot of people are like, why is this important? These tests are studied. These tests have strong sensitivity and specificity. What more do we need to learn about them? But we don't know how our athletes feel about them and how they perceive them. And by learning about how they feel about it, we can make these tests more engaging for them and more informative for us as researchers and clinicians. So that's kind of what I do currently. And here you can see that mild traumatic brain injury and concussion is not just limited here to the U.S. and football and with soccer and lacrosse. It's a huge issue, as Jason and Rob talked about, with the Department of Defense and in our armed forces. And so we're just localizing it here to Chapel Hill with the small work that we can do to hopefully one day contribute to an international issue. So next we'll have Dr. Jana Register-Mihalik talking about public health in the bigger picture.
Thank you again, Chancellor Folt and Chairman Stone. One of the other areas that we study is, of course, the youth and adolescent recreational and student athlete. And there's no group that I'm more passionate about than our children and adolescents. They are often the people who sometimes don't have the best health care or they don't have the best information. Many people sitting in this room help facilitate the conversations that we have with parents and families around this injury, especially this time of year. We get numerous media calls, numerous family calls and parental calls about what they should be doing about their children. And that's a good thing in a lot of ways because no injury has really received the amount of attention in recreation and sport that concussion has. In the summer of 2014, President Obama had a summit that was completely devoted to concussions in youth sport. Dr. Guskiewicz had the opportunity to attend that summit. The Institute on Medicine has put out a report that has 6 charges of how we should be dealing with this injury, and much of our work led to the things that are part of those 6 charges, and we continue to address many of those today. One of which is a great focus of some of the work that we continue to do and that I am very interested in, which is how we change the culture and the behaviors around this injury. Because as much as we have moved forward, we still have a long way to go in terms of the way that people think about this injury. And one way that we look at this is from a public health model that we call the Socio-Ecological Model. And what this model does for us is allows for us to understand how different levels of society actually interact to influence change. And so if we only address things at the athlete or the patient level, we won't see the change that we hope to see around a particular problem. We have to address things like policy and legislation, and not only just having it in place, as we all know, it needs to be enforced and monitored. So here in North Carolina, in 2011, we passed our concussion legislation, which has 3 major tenets, and we are a major component of that in helping facilitate how that is enacted and continues to be carried out. With other partners across the state, but people have to have medical clearance to return to play. They have to have education around concussion, and they have to have concussion plans in place. So that's at public middle schools and public high schools. One of the issues with that is how do we get that information out? So we've done a lot of research around what information should be part of that, and we're continuing to do research about how we implement that and how we help facilitate that process in our middle schools and high schools, especially those who don't have the same resources, such as having access to a certified athletic trainer. The second part of this that you will see is the community. So society as a whole needs to understand and buy into this problem, but we also need to help them have the right information. And the media sometimes is very helpful in that process, but at the same time, we want to make sure that people are understanding the information that is out there. So we work very hard to have evidence-based information be part of the messaging that we put out there, but at the level that people understand what that information means. We've heard over and over again today that we can do great work, but if it doesn't make it down to the grassroots level and to the people of North Carolina, where is that work actually going? And so we spend a lot of time researching the ways that we can do that. Also, we have to have buy-in from organizations. So whether that be schools, whether that be medical organizations, we need that buy-in to understand how to deal with this problem and implementing best practices, which is not always an easy thing to do. And then we have relationships and interpersonal aspects that we study. So the pressures that come from parents, that come from coaches, that come from teammates, those all play a significant role in how an individual would respond to any injury, but specifically concussion. So individuals who don't feel supported by their organization, who don't feel supported by their coaches or their teammates, we found through our work that they are significantly less likely to seek care for that injury. And even parents who don't feel supported in that aspect are also less likely to seek care for their child. And so we spend a lot of time trying to figure out how we can solve that problem. And then the last part of this is really addressing that individual level. So we spend time understanding what do athletes know about concussion, what does the general populace know about concussion, what do they believe about it, and then what are their behaviors around that. And as we started to investigate this back in 2010, We really aimed at the high school level first. We have connections to local high schools as well as high schools across the country to understand what athletes know, what they believe, and what they're actually doing around disclosing this injury. And what we found that was about 60 to 80% of high school athletes don't disclose the fact that they have a concussion. We're seeing an increase in the incidence of concussion if you look at stats over the past 10 years. And part of that is because more of these injuries are being identified. But even today, in some of our more recent work, we still see that number around 50 to 60% of these injuries are not disclosed or identified. And when they're not identified, they can't be managed and they can't be taken care of in the way they need to, and it puts these young individuals at risk for potential catastrophic injury as well as more subsequent severe concussions. We've also been able to work with amazing colleagues in the School of Public Health here at UNC-Chapel Hill. We have great collaborations through the Injury Prevention Research Center and also through the Department of Health Behavior in applying health behavior theories to this injury. So really being able to understand models that would help us develop effective interventions. So not just we as experts think this is a good idea, but what do the stakeholders and the communities think need to be part of that process. And as such, that really led us to think about what can we do besides address knowledge, because some of our work has also found that no matter how much people know about concussion, they still don't deal with it the right way. It's more about what they believe about what's going to happen to them or what they think is going to happen to their families or the response to that injury than it is what they know. So most people know concussion is a serious injury and they should do something about it, but if they feel that they're going to have significant repercussions, or if they feel it really maybe didn't bother them the first time they had one, they're less likely to report that injury. Also, if they feel like their playing behaviors are leading to great success, even if it's putting them at risk for concussion, they're not likely to adapt those behaviors. So we started thinking about how we could look at things beyond knowledge, beyond what people just know, and actually get in there and change the way people do things and the way people act. And so we've worked with coaches, we've worked with things about, like you saw, the situation room where we dissect game film and look at how we can think about changing rules, but also how we can change individual playing behaviors to put people less at risk for concussion. And all of this really comes together for us to think about how we can change the overall culture of sport. And one of the studies that we currently have ongoing, which we just finished our first football season of data collection on last week, is something that we refer to as BMOD. So we're looking at altering playing behaviors in high school football players that place them at risk for concussion. So we use the technology that Rob showed us earlier with the hit system inside high school football players' helmets, and we identify players who take too many hits to the top of the head because we know that places them at risk for cervical spine injury, but also concussion, and players who take too many hard impacts, essentially. And we have an algorithm that we've developed through some pilot work, as well as using it clinically to sort of help people adapt their playing behaviors to have this funded study. And we take those players and we put them through a mentorship program, an intervention, and then we monitor them after the fact. And so what we've seen over this past year anecdotally is many of our players who've been through this, they have changed their playing behaviors. And they want to be part of this. They want better instruction. And this is a really hands-on intervention. Our team is out at the schools every single day. They're at the football games, videotaping these games. It's incredibly time intensive. And again, we have an amazing team of people that go out and do this. This semester was at 3 different high schools. Next year we'll expand to 4. But it's a really exciting project. It's one of the first projects that's ever really looked at. Let's actually change behavior and see what happens from that. So more to come on that as we continue to move through that. And then the last thing about culture change is that it takes a long time. So this is my daughter, who she's 4 now, but this is one of the first times she ever rode a bike. And I'm from Slocum, Alabama originally. I've been in North Carolina for 11 years, and we didn't wear bike helmets growing up, right? So I still have to put a helmet on the handlebars of my bicycle to remember to put that helmet on. My daughter would never get on anything with wheels on it without first putting a helmet on. And so we use this to illustrate that sometimes culture change takes a whole generation. I think we've accelerated that with concussion in the past 10 years. We've seen a significant change. But we have to do things just like this, change things in people's environment, change the way people believe about things. And there's no place for us to do that better than here at UNC-Chapel Hill. We have support from the grassroots level. Both Jason and I this past year were recipients of Junior Faculty Development Awards that have facilitated this process, and we have funding from the grassroots all the way up to the federal level to support this process. So we really believe in understanding all levels of sports, but also in working with the grassroots level all the way up to the NFL, which some of our work has done, because it takes that sort of both directions approach to be able to truly see change. And so I think Jason's going to talk a little bit about how we use these ideas from an entrepreneurial perspective to actually integrate into society.
Thank you, Jonna. Kevin mentioned earlier about taking our research and impacting change, and one of the ways that we do that is to essentially socially entrepreneur our findings. Research doesn't really help society if it stays parked in a dusty volume of annals somewhere in a library. And back in May, I was very honored to be invited by the Chancellor to attend her entrepreneurship boot camp. If that ever comes up for discussion, it was highly valuable, and I hope the Board of Trustees will continue to support those endeavors. Lowry Caudo played a very big role in that and learned quite a bit. And one of the first lectures in that was from Buck Goldstein, who framed the entrepreneurship mindset and was very helpful in kind of affirming what we've already been doing in the Gfeller Center, but then also to drive ambition to innovate and pioneer change. So one example of how we've been entrepreneuring lab work into public safety is a few years ago I was very fortunate to co-author 2 smartphone apps with a colleague of ours at Children's National Health System in DC. The one on the left is a free app. It's available on your phones. I won't be offended if you jump on them now and download it. But essentially it puts all the information related to concussion injury identification right there in the hands of the parent, of the coach, of the person that would be handling this, and that could even be a teammate. So not everyone has access to an athletic trainer or medical professional on site. Even high schools that employ one, that person is typically at a football practice, which leaves the other sports unattended. So this was our way of saying, we know information is good. If we give it to you in the palm of your hand, there's no excuse to take care of these kids. The other one, there's a fee for it, and it's for clinicians. I won't belabor you with that. But this is just one example of how we've entrepreneured that. There was a story with Kevin in 60 Minutes. That was another example of kind of getting out there in the national media and doing that. Jonna touched on our BMOD study, and that'll be the focus of an upcoming NBC Nightline story as well. So again, entrepreneuring our findings into a venue, into an environment that the mass public can see and appreciate and learn from. With that said, I'll invite Kevin up to kind of wrap up.
So just in conclusion, I hope you can see the breadth of the work that we do. It certainly goes beyond the sport of football here at UNC-Chapel Hill. The goals of our center really are to try to help identify predispositions for injury, and not just concussive injury, but catastrophic outcomes. And we have another center, the National Center for Catastrophic Sport Injury Research, that's existed here since 1981. And you'll see that center's name showing up often in the media. We try to modify behavior and change the culture. You've heard just about everybody here mention this. And really, I think we have great examples here at Caroline of how innovative science can be a true game changer. And we look forward to continuing this work. Look forward to continued support that we have from the campus community here. We have an amazing team there that's pictured there in the bottom right-hand side. That we couldn't do this work alone. As I said, we've come a long way from 1995 when we started in a lab that was about the size of the table here. And we couldn't do this work without the support of the Matthew Gfeller family and foundation. Chuck Duckett just stepped out for a second, but I think Chuck would agree, and anyone else that knows the Gfeller family, if you know anything about the tragedy that Matthew had and that his family suffered in 2008. When he died on a football field in Winston-Salem, his family wanted to turn a tragedy, as Chuck walks back into the room, he knows the Gfeller family very well, turn tragedy into something very positive by establishing that foundation. And then 1 year to the day of Matthew's death, his father, Bob Gfeller, who was moving his son, Robbie, into a dorm here on campus, asked to meet with Jason and Jonna and myself, and we sat around a table over in Fetzer Hall and talked about the great things that we could do together. At that point, we named the center. We moved it above the top floor of the Stallings Evans Sports Medicine Center, which I encourage all of you to stop by and visit at some point if you can. It sits right there next to the outdoor pool. And because of really the dedication and gifts of the Gfeller family, we are able to do the work that we do. So thank you. And Dwayne, I don't know how we are on time. If you want to I'm happy to take a few questions. We're all happy to take questions. Sure. It's a 3-year study, but we're already trying to secure additional funding beyond the 3 years. As Jason said, there's about 24 current universities that are involved in the smaller part of that study. We're one of the 3 sites that are doing the extensive in-depth look at biomarkers and all that, but it's in the neighborhood of about $40 million, that award is a multi-center study, of which a significant, I'm not sure the exact dollar amount that comes to us at Chapel Hill, but it's in their neighborhood of probably about $1.5 million to $2 million over the initial few years, and I'm confident that we'll see an extension of that over the next, this is going to take, to do this in a prospective way and to be able to continue to study these athletes beyond the years in which they're playing is going to be important to better understand the long-term neurological concerns that may or may not be there. And that was one of the points we made on 60 Minutes the other night, is that while the media sometimes has sensationalized this, the media's been good in the respect that they've helped to increase the education around concussion, but oftentimes they've sensationalized this and people are left to believe that every former athlete's going to end up with dementia or depression at the age of 50, and it's just not true. 4 out of every 5 that walk through our door, through our Center for the Study of Retired Athletes, actually look pretty good at about age 55 to 60.
It varies. We have good years and bad years. We typically see as few as 3 or 4 in a year, to as many as 15 sometimes. If we could pinpoint the years we have 15 and why we have 15 those years, we'd be sitting next to him getting some Nobels. But that's what we're trying to figure out. And we have years where we have a lot, and then we have years where sports that we don't expect to have a lot of concussions do, like volleyball and crew. We've had concussions in those sports that I see a couple heads shaking. We don't normally see them, but sometimes we just have a lot. Boats slip and people hit each other with paddles while they're on the water, and just random things that happen. So one thing that we do see a lot of in our student athletes is motor vehicle crashes, mostly scooter-related accidents. So you'll see them zipping around campus, and there are efforts here on campus to instruct the athletes on scooter safety and how to manage the roadways while they're riding. So it's not always on the field that causes the injury.
Yeah, so the NFL changed their kickoff rule in 2011 as a result of some of our data that showed that the kickoff was the most dangerous play, not just for concussion, but for catastrophic injury as well. And so they moved the kickoff line up from the 30-yard line to the 35-yard line, which allowed for more touchbacks and balls being kicked through the end zone. We also minimized the running start, as opposed to a 10-yard running start, to a 5-yard running start. So that reduced some of the physics of the collisions when they do occur. And that's where we saw this 33% reduction in the number of returned kickoffs and about a 45% reduction in concussions on that one play. We're now beginning to look at the punt, and we may see a day. I had a conversation with John Swofford recently. Chancellor Folt asked me to serve about 8 months ago to represent the ACC as our representative on the Concussion Autonomy Committee. So the Big Five conferences have a representative on each committee. So I was meeting with Commissioner Swofford about a month ago over lunch, and we talked about how we might think about changing the punt. And it actually was in the USA Today yesterday. Someone sent it to me where I mentioned this. But we could see a day, perhaps, where there is no punt team out there. There's a punter, a snapper, a punter, and somebody to return the ball. So the punter would kick the ball, and wherever the receiver caught that ball is where that team would receive the ball, and the offense would begin, or where they kicked it out of bounds. That would, in fact, reduce concussions in the sport of football, I believe, in a significant way. So there may be more to come on that. But if we do that, we're going to need to take the word foot out of football, I think, because we will be changing significantly both the 2 plays in which the foot is involved, kicking. So. I mean, boxing is, no, we get that question often. It's a great question, and I personally think that that boxing should be banned. I think when the goal of the sport is to knock the opponent out, that is a problem. And if you think about it, I remember as a kid, and my guess is that many were the same, we always knew who the heavyweight champion was at any point in time. I couldn't tell you today who the heavyweight champion. So has there been where we see neurological decline in individuals years after their participation in sport, it's often boxing. Parkinsonian is a big component. The MCI, mild cognitive impairment, but more than that, Alzheimer's. And so there's a disproportionate number of cases there. And so I think we don't even use it as a model anymore.
And I'd add, there's a distinction between amateur and professional boxing. In amateur boxing, they're padded and there's a point system, and they don't just get points for blows to the head. So I would handle that very differently in a conversation than I would professional, where the intent is to render your opponent unconscious. Absolutely. So part of our baseline testing does not include the neuroimaging at 500 an hour and 700 athletes. That would be very cost prohibitive. It is part of our post-injury testing, mind you, and there are things that we've seen on there incidental to the research scan. So every scan that we take post-injury for an athlete that's part of that protocol is read by a clinical radiologist for things beyond the fancy diffusion tensor imaging research data that we're trying to acquire. And in some of our athletes, we've identified incidental findings unrelated to the research that we've reported back to the clinical staff that we otherwise wouldn't have seen. We mentioned the NCAA DoD project. We had meetings at the NCAA headquarters earlier this week, and there was one group that was doing imaging, looked at incidental findings, and identified a brain tumor in an athlete that otherwise would never have been seen because imaging was not part of the standard clinical practice. So that hasn't happened here, and I'm not suggesting that's what we're looking for, but these are things that could happen that would indirectly benefit athletes with early intervention. As far as the baseline testing that we do, we have basic clinical testing, neurocognitive testing, so we're able to find athletes there that might self-report learning disabilities, for example, that they otherwise would not have reported through the system of admissions or through a preseason physical examination. It's one of the questions that we ask for, so in those athletes, we tend to put a little heightened alert on it and dive a little bit deeper and let them know that there's resources here on campus that can assist them, and they should communicate with their medical staff accordingly. And we've had some athletes that said, oh, we weren't aware. So that's one benefit, I think, to some of the testing that we do. And we also do a screen, it's a test called BSI 18, and one of the 18 questions is, have you considered ending your life? And so it's a new metric that's part of this NCAA DoD project, and anyone who answers at a threshold that is of concern, we immediately get a text message and an email from the data hub to say, athlete X reported a value that is of concern, and we immediately have a protocol in place to contact the healthcare professionals that work with that athlete.
So I was going to wrap up. Maybe we'll take one more question and then. Thank you. And one of the things that we talk about is that we have a lecture that we've given with the title that is something like Sport Concussion, Paranoia versus Legitimate Concern. And I think that that is where we can be really have an influence on the way in which parents can be better informed, society in general can be better informed about this, because we do fear that many parents are pulling their kids off of athletic fields, and we're going to end up with a society in which we're going to see an increase in childhood obesity and diabetes, which we finally in the last 4 or 5 years have seen a leveling off of that since about 1996. And so we need to do our part. This is a public health issue. But I just want to thank you all. I want to I'll finish on a comment that Bill mentioned. Oh, I'm sorry.
I was just going to make a comment. You know, for a number of years we've talked about taking our best ideas, our best innovations out into the world and making the world a better place. That's what we want to do at Carolina. I can't think of a better example of innovation and impact than what you guys are doing. And I love the fact that you're looking at the commercial angle and the economic development angle. But this is really important, and it's a wonderful example of what we're trying to be at Carolina. So thank you.
Thank you. Yeah, sorry, I didn't mean to cut anybody off. If there are other comments, I know we have another speaker. I just want to comment that, Bill, Destiny is very representative of the undergraduate students that we have. We have amazing, amazing undergraduates at Carolina. We're so happy to have many of them working through not only our laboratory, but laboratories across the entire College of Arts and Sciences. I couldn't help but think, listening to Dr. Sanjar about his the example of learning that Holden Thorpe had sat in his, as an undergrad, sat in his group meeting. I believe one day, and I'm going to do everything I can possibly do to see that one of these three individuals, Jason, John, and Rob, position themselves. We will position them for a Nobel laureate. And Destiny, you someday may be chancellor of this university. So, thank you.